Hi, this is Irene. I chose to do the movie One Flew Over the Cuckoo's Nest. So, an overview of the movie, a short overview, is the movie's about the main character, Randle McMurphy, who's played by Jack Nicholson. He is admitted to an inpatient psych hospital for evaluation. He is sent there from a prison after having some behavioral issues there, like violent behaviors and fighting. He is at first entertained by being there at the psych hospital because he's thinking that it's better than prison. He also encourages other patients to push back against the establishment, like Nurse Ratchet, which is the main nurse there. At one point, he even escapes and steals a boat to fish out of one day. He takes a lot of the other patients with him on the boat. He also develops quite a few friendships in the psych hospital, which you would think of was unlikely. He ultimately stays and helps the other patients see how misguided they are in the hospital. And since he acts out in his behavior towards the nurses and staff, it ultimately gets him lobotomized in the end. Okay, so some possible diagnoses for the main characters are Randle McMurphy, who's the main character, so antisocial personality disorder. Chief Brondum, schizophrenia. Dale Harding, paranoid personality disorder. Charlie Cheswick, dependent personality disorder. Billy Babbitt, he has a stutter and a possible learning disorder. So all of these are main characters, but I'm going to focus on Randle McMurphy, but I thought I'd just put those other few characters in there as well. So the chief complaint of Randle McMurphy is that he was in prison for statutory rape, a rape of a 15-year-old, which he stated that she said that she was 18 and was asking for it. He also has aggressive behavior, which is shown in the prison. He didn't obey the prison rules, and which then alluded to him malingering just to get out of prison, and malingering meaning that he's faking it just to be out of prison and in the mental hospital, which is far better than prison. So some interview questions I chose to do was, do you have a history of violence? And the answer to that, he would answer, yes, he does have quite an extensive history of violence. He was aggressive at the prison, and that's ultimately why he got sent to the mental hospital. So have you ever abused drugs and alcohol? His answer would also more than likely be yes. He drank in the movie, actually. And is there any risk-taking behavior present in him? Yes, he would answer yes, there's quite a bit. He takes risks all throughout the movie pretty much. And then how would you describe your past relationships? So he would answer this more than likely being that they all failed. Most of his relationships failed. He's never been in a monogamous relationship with anyone. And ultimately they leave him. And next is, do you see or hear anything other people don't? So he would answer no. He doesn't see anything other people don't. He doesn't have any hallucinations, visual or auditory. And then how is your appetite and sleeping? He more than likely would eat normal. In the movie, it doesn't really show neither eating or sleeping disturbances, but from what I gathered from him is that he had a normal appetite, and he probably didn't need very much sleep. He did show a little bit of mania in the movie. And then, do you have any family members with a mental health history? More than likely he wouldn't know, so he'd probably answer he had no idea, but his family members, close family members probably do have a history and just don't know it. So last, have you ever been hospitalized before or undergone any treatment? So in the movie he actually states that he's never been hospitalized, and he didn't say in the movie, but undergone any treatment, he said. He doesn't say in the movie if he's undergone any treatment, but more than likely, again, he did not, since he hasn't been hospitalized. So behavior observations I noticed in the movie was a lot of risk taking. So the picture to the left is them on a boat, which he escaped from the mental hospital on a bus and took quite a few of the other patients with him, which is a huge risk-taking behavior, puts all of them at risk potentially because they all have some mental health disorder. And he also has no regard to consequences and no remorse. Once again, that's kind of also taking the boat, and no remorse being that he also had sex with the 15-year-old and didn't care. And he encourages others to break rules. He encourages others and breaks rules, both at the same time. He got all these patients to go with him, and he doesn't comply to any rules. And he's very social, high energy, and engaging. He was very almost flattering in the movie and flamboyant. So the implied diagnosis in the movie that I chose was like, even though it's not a actual diagnosis, malingering, which is actually a V code, meaning that they can't bill it. So the definition of that is exaggerate or feign illness in order to escape duty or work. So in this particular movie, they implied that he was malingering or faking having a mental disorder to get out of the prison. But further on, I'll explain that he meets criteria for antisocial personality disorder. So this is the DSM5 criteria for antisocial personality disorder. So since age 15, 3 or more of the following needs to be, he needs to have 3 or more of the following to be able to be diagnosed with antisocial personality disorder. So the first one, failure to conform to social norms with respect to lawful behaviors as indicated by repeatedly performing acts that are grounds for arrest. So in the movie, he's in prison, so he's obviously been arrested, and he does not conform to social norms. He breaks laws and goes out of his way to be a rule breaker, pretty much. So number 2, deceitfulness as indicated by repeated lying, use of aliases, or conning other people for personal profit or pleasure. So he does seem to con people in the movie, but he did not use any other aliases, and I don't really remember him ever lying either, but I would suspect him to lie to gain profit or pleasure. So the impulsivity or failure to plan ahead, once again, I'm going to refer back to the boat. That was the biggest thing he did as an impulse and failure to plan ahead. He just stole a boat and had no plan and just started to go and pretty much took off without knowing where he was going or what to do. And he had all these other patients with him. Next is the irritability and aggressiveness. So the main reason why he got out of the prison was because of the physical fights. And he does show some irritability when Nurse Ratched in the movie does not allow him to watch the baseball game. He doesn't get aggressive, but he definitely gets very irritable. Reckless disregard for safety of others and self. So once again, the boat, he took people out on the boat and didn't care for their safety whatsoever. So consistent irresponsibility is indicated by repeated failure to sustain consistent work behavior or honor financial obligations. In the movie, it does not show if he honors financial obligations or has consistent work behavior, but considering if he is malingering, he wants to get out of work. And if we knew more about his story, I'm sure that he doesn't have the best financial track record. And then lack of remorse, the last one, going back to the 15-year-old that he was accused of statutory rape for, he had no remorse for it whatsoever, and basically was in denial that he did something wrong. So continued to meet the DSM-5, he had to be at least 18 years old, which was true, and then the conduct disorder with onset before age 15. So we don't know his story before age 15, but he has been in and out of prison. So I'm just assuming that he has conduct disorder, had it before 15. So then the occurrence of antisocial behavior is not exclusively during the course of schizophrenia or bipolar disorder. Okay, so my suggested treatment plan was mainly like therapy. So I chose cognitive behavioral therapy and dialectical behavioral therapy, which is basically showing the patient their feelings and helping them understand them and cope with them. And then limit setting. Setting boundaries for him would be very important due to that he's he's very reckless. And then medications. There's no real medication for antisocial personality disorder, but they can treat the medications can treat the symptoms of it. So like depression, anxiety, the aggressiveness, those specific symptoms. And so the outcomes that I would look for after my treatment would be the patient would be able to control his impulses better. He has more nonviolent responses. And then the medications help treat his symptoms. So if he gets irritable, angry, impulsive, the medications will help with that. And then the dialectical behavioral therapy would help him understand his feelings once again. And then the cognitive behavioral therapy would help improve his underlying thought patterns. Okay, so the treatment in the movie was pills, in quotations. I put that because I put that because they give him pills without telling him what they are, and I don't know what they are either. So they gave him that, and then there was group therapy, which was led by Nurse Ratchet, the ECT, activities, socialization, and the lobotomy. So the outcome for the movie treatment was that the ECT only strengthened McMurphy's will and spirit. So after he got it, he came back to the patients and was actually still free-spirited and just as excitable as he was before. And then the group therapy in the movie was, the only thing I thought about it was that it was very chaotic and a lot of people were yelling in it. So he did not gain anything from that therapeutically. He actually basically sat back and watched the chaos. And then the lobotomy for it, technically they got the outcome they wanted from the lobotomy. The lobotomy made him more manageable, but it did not increase his dependency. So basically now he needs to be dependent on a bunch of other people since he got that lobotomy. And lobotomies are no longer used in practice. Okay, so mental health concerns I noticed in the movie for McMurphy was his irritability, followed by violence, which he had in the prison, the impulsive risk-taking behaviors, which would be like stealing the boat, and he's probably also stolen a bunch of other things, and had no plan whatsoever, but just did it. And then the no remorse. So this is actually a quote from him, McMurphy, in the beginning when he was getting interviewed by the doctor about how he committed statutory rape. So, quote, she was 15 going on 35, doc, and she told me she was 18. She was very willing. I practically had to take to sewing my pants on shut. So that kind of showed the no remorse to me, because he didn't care that she was 15, and he still didn't feel that he was in the wrong. So, current practice. So the ECT is actually still used, but not like they showed it in the movie. So in the movie, they don't sedate him. They put a block in his mouth so that he doesn't bite his tongue. And the pads are bilateral instead of unilateral. And with an ECT today, they put it on only one side of their head instead of both, which helps do less damage to the brain. And then medications I chose, which obviously still are in current practice, and I do not know what they gave him. So medications today are newer and can work better. And then group therapy, which is obviously still used today, but in the movie it was Nurse Ratched that was leading the group, and more commonly today it's led by actual therapists. And then people in the movie actually smoked, even the patients, which is not within current practice or even legal to smoke in a building. And then I put L points, which is actually ligature points. And ligature points are places that oneself can hang, that you can hang yourself at. So all the door handles were normal door handles instead of being the kinds that are on mental health institutions we see today. And there were also a lot of bars that you could hang yourself from. So there were just a lot of ligature points in overall, and that's what I meant by L points. I forgot to put ligature. But then the lobotomy, obviously not in today's practice at all. So yeah. And then that's actually the end. So thank you guys for watching.